Welcome to Beacons of Light, a series dedicated to showcasing the extraordinary faculty members of Walden University. On the screen in front of you, you'll see the media player and a Q&A window. You can also access the attendee chat from the toolbar at the bottom of the screen. To submit questions for our guest, please use the Q&A window. To access closed captions for this event, please select the CC or Closed Captions button in the lower right corner of the media player window. And now, please welcome our host, Chief Academic Officer, Dr. Sue Subocz.
Good evening, everyone. Good morning for some of you, perhaps, and good afternoon for others. I can't believe this is our fourth episode of Beacons of Light. It seems like yesterday I was kind of nervous to interview our first guest, and here we are tonight with our fourth. And so we've had a lot of really great multidisciplinary conversations and really digging into the research of some of our great faculty. We've talked with one of our professionals from the social work area. Last episode, we had one of our business faculty members with us who's launching a new concept into the world. And we had an exciting conversation with him. And interestingly, our very first episode featured a nurse during Nurses Month. And at the time, everyone was really, really hopeful that we were on the downside of the pandemic and we were going to, the vaccine was just really getting out there for widespread adoption. And we thought by the time we got here to August, we'd be on a different trajectory than we are today. And so, Suri, in another circumstance, we might have been having a conversation tonight in reflecting on the pandemic. And instead, we're going to do some reflecting, but we're still right in the midst of it. And so this is a very timely conversation with you. One thing that we have dedicated ourselves to in this series is not spending 10 minutes on bios to tell everybody who I am and tell everybody the long, sometimes boring resume that goes with an introduction. So what I'd like to really do is just give you the opportunity to share a little bit of your research and what's top of mind for you right now these days in the midst of this public health crisis that we're facing.
Thank you for providing me this opportunity, Sue, for providing some opportunities for sharing some of my research and that is out there with COVID. But more importantly, from that research, some of the insights that I have gained along the way. And that journey, if I think back, started from my interest first in infectious diseases when I first went to India. And, railway stations are very common in India. And so I came across an homeless individual who had tuberculosis. And, one of the critical questions that came to my mind is, why is it that this individual is so severely sick and there's no help for this person? And that is where my inquisitive mind, but also my empathy, came in, and I wanted to do something to make a difference. And so, I decided that at that point, I decided that being a physician was going to be, my path. But as I evolved and as my journey progressed through the years, through spending time at the Centers for Disease Control and looking at population level measures, my interest shifted more towards public health. And now a lot of my research is geared towards understanding what are some of the factors, especially social factors, that are making for disparities in vaccine uptake. So the fundamental question is, why is there disparities in that uptake? And I have several types of research that I will be sharing and presenting that I have done in this area.
Yeah, so Sri, I think in one of our conversations, we talked a little bit about my background and working in the Coast Guard and, in thinking about emergency preparedness and emergency management, similar issues of disparity in preparedness, disparity in how, social factors weigh into response. So could you talk a little bit about social factors and the ways in which they come into play as, we look at first we were looking at disparate impacts of COVID based on various societal factors, and now we're seeing, with uptick on vaccinations and other, advice that's being given or opportunities being made for, for treatment. What do you think are the social factors behind that based on your research?
Sure. I can get into that a little bit. But before talking about that, I wanted to also talk about emergency preparedness and how important it is. This pandemic, if it has taught us nothing else, one thing that we have really learned is that we need to be prepared, for the next potential pandemic, because as I have identified in myself and other researchers in our social change grant that we are working on, that this is in fact a pandemic era. Every 2 to 3 years, we're seeing patterns of, say, if we go back 10 years ago, with the pandemic that's been there, we're seeing patterns, and so emergency preparedness is at the centerpiece of this, and I think requires a lot more focus. But going back to the point at hand that you raised, very importantly, talking about social factors. When I first, start talking about this, and I've had, numerous conversations about this with my colleagues as well. Dr. Angela Pren, we have been, and in conversations and social factors. One of the biggest things that is important is to have a good model, and the tree is a really practical model to understand social factors. Three things in a tree, right? Branches, the trunk, and then the roots. So if we think about the branches, we're thinking about the outcomes that we're thinking about. So if we're thinking about mortality outcomes, increase. So it was seen through research that in minority communities, COVID was more causing more death, more mortality, than in the majority population. So these were patterns that we're seeing. So the branches are these outcomes. So the trunk would be talking about maybe engaging in risk behaviors, some sort of individual behavior. But then the root cause, that is where we want to think about social determinants, because those are these factors which people really can't see. They're hidden on they're, for instance, implicit bias. This is something that is not really seen. Microaggressions you might think of. These are not something that you will immediately be able to identify, but they're playing a role in influencing the outcomes. So now applying this to COVID, as I said, to some of these social disparities and disparate access. So lack of access to healthcare. And I can explain that further in the context of geospatial research as well. But some of these disparities, you can kind of see there. And these disparities are not only present from a research angle. From my time in Baltimore seeing patients, I've witnessed firsthand some of these disparities, which I can share as well.
Mm-hmm. Well, you said something interesting there, Sri, which I think might surprise some people. You said we're in an era of pandemics and there have been patterns. And I think if you stood in the middle of, the average city in the United States and said that, people would look at you like, what are you talking about? Like, so in many ways, it's been sort of behind the scenes for most people. So how would you respond to that, that surprise? Give us a sense of what these last decade or decades have shown.
And that's a very good question, because we want to think about and identify eras depending on usually positive things. If we think in the past, well, we've had the Gilded Age and certain eras, and of course, also with feminism, there's waves of feminism. So there's eras, and so what the premise is behind this argument is that this era is so significant, and this pandemic has changed our way of life so significantly. And I wouldn't necessarily say, all the changes are negative, but they are changes. That to the point that we have to adapt to these changes. So to the point that we have to be prepared that some of these practices that we are getting used to, for instance, masking. These are practices that in other countries have been commonplace for years, because this has been a known fact in other countries that a lot of these habitats are getting destroyed. A lot of these places, due to even global warming, a lot of vector-borne diseases are increasing, which increases the amount of viruses that can transfer from animal over to human. And so because there's so much habitat loss, a lot more development is encroaching on natural habitats, and so the environment, as these things evolve, these patterns, like having more pandemics, will become the pattern. Will become something of a normality, and so this is not to cause alarm by any means. On the contrary, this is the person that is most prepared will be the person that is able to adapt and succeed. So this is part of being an informed citizen.
Yeah. Well, Suri, I traveled to China in the fall of 2018 and observed what you're saying. And foolish me for not adopting the local practice is what I say in hindsight. And lucky me that I didn't have to pay for that because clearly, as you say, they definitely had a different perspective and a different experience perhaps than I had and maybe just more knowledge. So I've learned something tonight, and thank you for that. So I'm sure there will be more, but that's one that I can really take to heart. So speak to this emergency preparedness a little bit. You did there about individual preparedness. To our public health professionals and growing professionals in our audience, what kinds of things would you say to them are an important part of the things that they can do to help their communities or their organizations where they work think about this emergency preparedness from a public health perspective?
Yes, certainly. A very good question. So, emergency preparedness can look like certain things from different angles, and I'll explain to you what I mean by that. So, for instance, one context is, of course, for instance, psychological first aid. These things are important, especially when there's an emergency and people don't have the emotional skills necessarily, to cope with something like that. So preparing for that, that's one way. And so that's more of a mental health approach, and mental public health can investigate as to how better to prepare populations and to kind of minimize the shock that people feel. And that part of it actually, I have been involved in research with my colleagues in the counseling department, and actually some other students in both of the departments. What we're looking at actually is trying to look at the type of anxiety and connections between anxiety and sleep disturbances, and what types of patterns exist, so that because sleep disturbances in sleep are patterns that persist after even the pandemic is over. And they're long-term consequences. So understanding those consequences from a disease, mental health, or public health perspective is only one way actually of that disaster preparedness could be addressed. But also from an environmental health perspective, having access to food, water, and shelter, ensuring that these exist, is actually part of the role of a registered environmental health specialist. And that's one of actually my credentials that I have through the National Environmental Health Association. So a major portion of this is ensuring that the incident command center there's a whole protocol that's followed. The first person to report to the center, it's not actually anybody that's designated, is the person that takes charge of kind of delegating. And so there's very strict guidelines and things. And as part of public health training, people that have also a background in very strong basic sciences and math can actually apply for this credential. Definitely there's a lot of room and a lot of opportunity, I think, for emergency preparedness, and that is a job prospect that is only growing at an increasing rate.
Yeah, really interesting. And, we had a question from the audience, actually, Sri, which I think is really relevant here. So speaking about your collaborative work with folks from the counseling team, et cetera, one of our audience members has asked, first they say, I am planning to undergo my postdoctoral degree at Walden University. How can research collaboration with Walden University and the faculty help?
That's a very, very good question. I would like to start off by saying that by thinking of postdoctoral work, it's really important to be engaged in this, because past your dissertation, it's a lot of times important to hone in on specific skills that you might not have gained in your regular doctoral training. But to the point that you bring up about the need for collaboration, it's very important because the insights that can be gained from even the dialogue and the conversation, when the final paper is actually published and written, and the words that are contained within that paper is only probably half the words of all of the ideas that came from the brainstorming sessions and the back and forth and just pruning and everything that takes place in the research paper writing process. So that active collaboration and engagement by all members is what makes a finished product, that much better. It's important. It's not just important to just have anybody, collaborating. It's important to give some thought into assembling, teams, how to assemble these academic teams. When I was engaged in research in social isolation and loneliness, I felt, it was important to have an individual that's trained in psychology, in counseling, and also actually one of my former students who was well trained in infectious diseases. So we were looking at loneliness as it relates to COVID-19 and the
Mm,
social distancing measures. And looking at how the search frequencies changed within Google before and after the social distancing measures, and there were significant changes in that. That was one of many parts of that research project. But that's just an example
mhm.
that goes to show really, really how important and critical it is to have a multidisciplinary team approach.
Yeah, and I think I hear you saying there, Sri, is that you have to do your research so that you can do your collaborative research, and both about what it is that you're trying to get to, and then who can help you to get there.
Yes, yes, absolutely.
Yeah, I think that's like the story of life in most occupations these days. It's really hard to imagine the sort of siloed approaches that may have marked the past. Where I think now you've used the word social determinants of health, which cut across so many different disciplines. When we're having this conversation about our business and management programs, and what role does do ethical business practices play in creating a healthy society? And I think it's really just a mark of the times. As you say, it's an era of pandemics, and we have to prepare for the situation we have at hand. But I think in the workplace altogether, we have just so much more knowledge about the way in which one system impacts another, and one discipline's findings can influence what you learn and know in another discipline. And I'm really hopeful that we can elevate that kind of research to whole different levels here at Walden, because I think that's how the world's going to be changed in the future, not by the individual scientist in the lab anymore. So thank you for that collaboration across our groups. It sounds like we should all be waiting to see what you find, and I'll be looking. So that's good. I want to know. Um, a question that also came from our audience, as you look at sort of the what we hear out there today, it's prevention-based discussions. We talk about vaccinations and masking. Why would you say that the conversations have focused around that particular part of response, rather than a more holistic approach to overall health in response to this pandemic and maybe others?
Thanks for that question. Yeah, that's a good question, Sue. And it's important to understand the importance of prevention. Prevention is something that at the end is ideal and preferable, because it saves money eventually, because once a person has the disease, then it takes a lot more healthcare cost to be able to treat what the person has, rather than preventing. So at a fundamental level, our approach in public health is to put as many resources as we can in preventative measures. And this sort of emphasis on prevention, I think, is not just unique to public health, but in a lot of other disciplines as well. Since we're talking, cross disciplinary, even thinking about the environment, environmental engineering, where a lot of environmental health concepts come from, is also when you're disposing hazardous waste, you don't want the contamination to take place and then afterwards think about what you can do to clean up the spill. No, you want to make sure that the hazardous waste never gets out of the drums, to create the spill in the first place. And so at a fundamental level, that is the reason why we invest so many resources into prevention. But if we think about this more specifically, and think about the chains of transmission. And this was a phrase that was coined and used very specifically for COVID. And when we were thinking about conceptualizing and all of the contact tracing was taking place, the chains of transmission and prevention of those through masking and social distancing was important. Because, one person infects more, so it keeps the number of people keep multiplying, and so that is why it was more important there. Now, we're talking about overall well-being and overall health, right? And if we think about natural fish oils, for instance, omega-3 fatty acids, and a lot of the lipid lowering characteristics, things like that. Even through medical science, some of these therapies have its value. These therapies do have its value. However, when we're thinking about overall health and COVID, these should be something that you're kind of maintaining as overall maintenance of health, rather than thinking of them as prevention, to the point that it's prevention or treatment of the virus. It's so the problem is so hard to conceptualize this virus. How is it that something that you can not even see through a microscope, you cannot visualize this through a regular microscope? You have to go into a special room and look at an electron microscope to see an actual virus. When I first saw a virus in an electron microscope at the CDC, to go walk into this room was shock to me. So it's so difficult. We think that maybe if we maintain overall health, then that should be enough to get rid of something that we can't even see. But the reality is, this virus goes into your DNA and goes and hijacks the system, and then creates and multiplies copies of it. So this is why it's so difficult.
Yeah, it's pretty amazing. And I think that, for me, again, going back to my emergency management perspectives, risk management, and risk reduction go together. And so, I think a lot of folks are looking for sort of the magic answer. If everybody just does this one thing, then, but there really isn't. It's about, here are your chances, and you can decrease your chances by wearing a mask, and you can decrease them further by social distancing, and you can decrease them further, so on and so on. And absent, complete social and physical isolation, even of the air, you really just can't eliminate the chances entirely. And so I do think that has made the conceptualization of it all the more difficult, is that, even people who seemingly have done all the right things end up getting it. But that's because even though it was a 1% chance, it's still not zero, because 1 is not 0. And so that has really, I think, got into the consciousness of people, and that all of those areas that you say. So I do have to ask you a little silly question now, Sri. So you go into the magic room and you look in the electron microscope at a virus. What does it look like?
That's a good question. I mean, you think, honestly, when you're thinking about a microorganism, you think, it's a regular cell. It has a nucleus, but to see a hexagon shaped sort of capsid, and with all these legs, it's kind of it's really shocking. It's kind of magnificent but terrifying at the same time. That's the best way to put it.
Yeah. Okay. Well, that's going to be the phrase for the night. Magnificent but terrifying at the same time. Thanks for sharing that experience. We could feel it as you were saying that. So I want to ask some other questions here from the audience. You talked about geospatial, concepts earlier, and so one of our audience questions goes to that topic. Given the geospatial clustering of disease and the nature of open and closed networks, how would you suggest that global and local actors manage and get ready for the future?
That's a really good question. And what I'll do in answering this question, I want to give an example of how geospatial it kind of studies work as I'm sharing this story. So, in my experiences in Baltimore, you see neighborhoods, and you see the location of supermarkets and grocery stores, or lack thereof, in different neighborhoods. So you as you're driving, you kind of see these patterns. So in my time at Hopkins, what some of the research that I did with geospatial was understanding the distribution of supermarkets with fresh foods. Because after all, food deserts are really, really a major problem in urban areas. These are patterns through geospatial analysis, that I was tracking. So through that gives you an example of how you can use clustering analysis to understand, what are areas which have more of certain things. So, for instance, now let's use the same example, but replace food deserts with health clinics. So we were also tracking patterns of STI clinics, sexually transmitted infection, clinics, and there weren't too many as of that as well. So similarly, now when we're thinking about COVID, patterns of pharmacies that carry the vaccine, and looking at neighborhood patterns. And there are, if you look at these patterns, there's disparities in these vaccine areas. And so this creates disparities in access, health access. And so that would lead to, certain areas having more vaccine uptake versus other areas having less uptake. So, in this example, what I'm trying to show is how also you can use this geospatial data to provide equity-related conclusions and a pattern understanding.
Yeah, that's a really interesting application and analogy you make there, Sri. So, when you think about this sort of concept of open and closed networks, what impact do you think that has on both preparedness and how individual communities respond?
Yeah, so yeah, that's a good question. And so, you know, having a way to, have open communication and openness between communities is the way to the future.
Mm-hmm.
Having insular sort of closed, not sharing resources will not allow for us to address the pandemic. So, one scenario to illustrate this, for instance, the global vaccination efforts, right? If we think about what part of most of the population is vaccinated, it's very little. And in some places, the unfortunate reality is that there is a supply of vaccines, but in some cases they're not willing. In other countries as well.
Mhm.
There was also this scenario where a lot of the vaccinations were going to people or countries that were paying, and then the countries that were not getting vaccines. There were all of these situations. At the Serum Institute in India, I can give you a kind of illustration, is the largest vaccine manufacturer in the world. And yet, in India, the population, only 1% of the population was vaccinated. Even though all the vaccines and so many of the vaccines are being produced there.
Hmm.
So you have all these contradictions. You have some places you have a lot of supply, not people taking it, and then other places you don't have the supply.
Yeah.
As it brings back to our point earlier that these issues are complex, and as researchers, we oftentimes think that we want to solve all the problems in the world, but the reality is, as researchers, we can only solve one small portion of this. And when you go to these conferences and you're talking with fellow researchers, and you see that you worked on one component of it, and they worked on that same problem from a different angle and came up with another solution, and that is the magic and the beauty of this whole process.
Yeah, so Suri, I think you raise a really important point, another angle on collaboration in talking about professional associations and conferences. And earlier you mentioned the Environmental Health Association as well, with some certifications that you can achieve. So we have many public health students in our audience tonight. So what kind of advice would you give them around professional associations, particularly if they're new to the field?
Yeah, sure. Thanks for that question, Sue. We have quite a few important public health organizations that students can really get involved in. The most important one that we have is the American Public Health Association. I personally am very much involved in this organization. My colleagues, all of them are actively involved. And you can get involved as students as well, and you in many ways. You can be an active member of any number of sections. I am an active member of the mental health section, and I attend meetings, and you're actually able to do a lot of neat things. You're able to actually work on certain policies potentially, certain calls for action. This is kind of your opportunity to make a difference, even as being a student. It's never too early to start. And so, you can attend through the American Public Health Association, usually in November. There's a major conference, and of course, usually it's in different cities, but due to the pandemic, it's being held virtually again this year. And so, students also have an opportunity to present. And so there's a couple of posters that I have. Actually, one of my former students is presenting there on another vector-borne disease, which is dengue.
Wow.
Which, ironically, if you have immunity to dengue, there was some immunity that was afforded with COVID. So, a lot of these vector-borne diseases, and of course, it's not definitive that COVID is vector-borne, but they behave similar. But anyway, professional organizations are important places not only for involvement, but also to look for kind of the specific stance that your discipline holds on certain topic areas. So referring back to them is important. And as a student, actually, the dues are much less. So you get the benefits of professional membership with much less to pay. So if those are not convincing points, then I don't know.
Yeah, I don't know what else. It makes me want to
Yeah,
join your professional association if they'd have me, Sri. It was very compelling. So
yeah.
thanks. I have a few more questions from the audience. And so I do want to ask some questions about health communications. And, in the field of emergency management and, communications has really taken on a heightened and communications that are part of preparedness and a part of response. So could you speak a little bit to that? And then specifically, the question that we have here is, how do public health professionals safeguard against misinformation? And particularly when that misinformation might come from other medical professionals who post information contrary to what the CDC and public health officials are saying, which we have observed.
Very good question, Sue. That is so important. Misinformation and how actually to handle that. So I'm going to take that question first and then go back.
Sure.
So yeah, it's such an important topic, misinformation, and in fact, I'll start off by saying this, that one of the major concerns initially last year was that not only was this a virus spreading rapidly, but also misinformation was spreading just as rapidly. So at one point, there was this term coined known as the infodemic. And if you Google this term, it's still there. And the idea behind that is that the information was actually causing so much harm that in itself was an issue. And why? Why? Part of the issue, of course, is that this is new science. Viruses have been around for a long time, but the behaviors and the patterns of how the virus was spreading was not known completely, to everyone in the scientific community. So at that point, if there was guidance that was, coming from the medical establishment, what that seemed contradictory, then that may have been the reason, because not all information was known. And so that is actually the nature of scientific discovery and innovation. But the difference was that this was something that was needed in a short amount of time. From everything from knowing how the virus spreads to coming up with a vaccine, the race to do so was just so critical. So because one of the major reasons that information was so confusing was because this was the difference between life and death, and it was affecting so many people. I mean, look, we have had 4.4 million, close to 4.4 million deaths globally. This is not a topic that it doesn't make a difference. It doesn't matter, or this is a lot of people's lives. And so when information makes a difference between life and death, this is when, if you're playing telephone, think about that. How often do messages not end up exactly the same that they started, right?
Yep.
So that's one of them, one reason. But politicization of information was the other problem, other issue from the beginning. You know, equating mask wearing to a certain political leaning, or not mask wearing, or vaccinations, or that dichotomization is at the foundation of misinformation. Because now not only was there confusion about what is correct, but there was also a vested interest in wanting to think one way or another.
Mhm.
And then economics, played a role, and so many different um, aspects. So as researchers, how do we differentiate fact from fiction? And as epidemiologists and public health practitioners, we we pride ourselves in being able to discern that. And one of the key foundational concepts in our profession is correlation does not always mean causation, right? So because two things are happening simultaneously, doesn't mean one caused the other. So we are taught to discern levels of evidence, even like clinical trials are like randomized controlled trials. The conclusions that come out of that are superior to more observational studies. So we're constantly in our heads ranking levels of evidence. When we come across a piece of information, this is what we're doing in our heads.
Mhm.
So that's how you become an informed, not only consumer of information, but also a student, and a learner. Because as I always say, I consider myself a lifelong learner.
Yeah. Yeah. So you touched on something that another one of our audience members asked about, Sri. So the question, as is phrased from the audience, is how has ideological polarization within our society impacted how we plan public health responses, given that mask wearing and vaccination is now tethered to individuals' social identity?
That is a really thoughtful question. And I think it really brings us back to kind of full circle talking about, social determinants, and um, identity is, part of that, and how we think about that. So, let's try to think about going back to how these ideological divisions develop, right? So if we think about kind of a sociological perspective, in groups versus out groups, and how we categorize even the way people look. So mask wearing versus non-mask wearing, right? So that creates a sort of in group.
Mm.
And so like being like identifying with the team, like wearing a cap
Mhm.
that gives the other person a sense of who you are. So it's like, if you believe in a certain ideology, and but instead you are doing something contradictory to that ideology, then that actually places you in the out group. You no longer belong to part of that norm, part of that social norm. So who wants to not feel like they belong? Who wants to feel castigated or like an outcast? No one, right?
Mhm.
So part of human nature becomes that they try to solidify these identities and create these identities, and but unfortunately these identities are becoming more and more polarized because it's a vicious cycle. So then society becomes more polarized, which creates more individuals that are part of the in group, and it just, so it's, once there's this positive feedback, we have these positive feedback loops in medicine and biology all the time. And unfortunately these vicious cycles are positive feedback loops. They keep moving in polarized directions. Um, but our job as researchers, as advocates, as public health practitioners, and practitioners from all fields, is to understand how to bring this unity back.
Mhm.
How to and the key to this is empathy. At the end of the day, um, you know, we need to use our ability to connect with each other to bring unity.
Yeah, yeah, that's true in so many ways and disciplines and areas, Sri. So thank you for reminding us of that. So there's a related question here, I think, about some social identity concepts. And so a question from our audience relates to what you learned from your tuberculosis research about the structural and social barriers to preventing disease. And so I observed, as I think we're seeing now in some of the situations, a certain sense of mistrust from certain populations. And can you speak a little bit to how that mistrust might, play a role in one of the social barriers?
Sure. Yeah, I can definitely speak to that, and I can go back to the tuberculosis example as well, to try to, because I actually did do further research into understanding tuberculosis, multi-drug resistant tuberculosis, extensively drug resistant tuberculosis, and the slum population. So the largest population, slum population, the Dharavi slum in India, has a pretty significant amount of tuberculosis cases, and the tragic aspect of this is that these individuals are actually not counted as citizens, as in the numbers, and so when they're not counted, there's no funding, and so these individuals are forgotten in the country. And so there's so many structural barriers, not only in diagnosing the right type of tuberculosis, because in order to diagnose multi-drug resistant TB, you need a specific type of test. And in these areas, there's no funding, or there's just, even the record keeping is not consistent. I've gone through some of the handwritten records, and they just are not there. So, going from that to, I also did encounter, tuberculosis in Baltimore as well, and it took some persuasion to convince the patient that he needed to be there, in isolation, because this could spread in the community, right? So, the issue here is trying to address some of these barriers that surround diseases like tuberculosis, which are predominantly seen in the homeless population or vulnerable populations, and some that are, and of course, historically excluded groups. So, coming back to you said about social
barriers, and specifically around mistrust, Sri.
Right, social mistrust, yeah. And that is really important, thinking back to the Tuskegee syphilis experiment, and think about why some of these might have developed in minority communities. In the early 1900s, there was a study to see, kind of see the disease of syphilis, but after the patients were enrolled into the study, what happened was their penicillin was discovered as a treatment. But once the treatment was discovered, it was actually never offered to the patients. And this went on actually for 40 years. And so this study is often cited, and rightfully so, as a really important source of a reason why mistrust developed. And there's some scholars that would argue that along with that, there's the Henrietta Lacks example where there's where the cells that were studied were in fact taken without her permission. I've actually in biology also, and this is used in biology protocols. I've myself used it in lab as well. So these are examples of reasons why mistrust would persist. But I think it's important also to note that the guidelines that have come from major public health agencies oftentimes have been contradictory. World Health Organization have at times not agreed with what the Centers for Disease Control says, and vice versa. Mm-hmm. So some of this disagreement in policy and these unknown variables that I've talked about have also contributed to some of this mistrust. So I think education at the end will be key. And this is what my research from Mozambique, showed. Education was what at the end made the difference between diphtheria vaccine uptake and not.
Yeah. So I'm going to follow up a little bit on that tuberculosis connection, Sri, with another question from the audience. And so we know that there are now drug-resistant versions of TB, which you mentioned. And with the fast spread of the Delta variant of COVID, how does what we've seen with tuberculosis' evolution inform our approach to stopping the growth of newer, deadlier strains of COVID? Or are there other examples, that you could draw on that might relate?
Yeah, that's a very good question, Sue. The idea of and then the principle of resistance, I think is important to understand. Now, but before we think about the principle of resistance, it's important to note that tuberculosis, of course, is a bacteria, and we're thinking about COVID-19, coronavirus disease 2019, as a virus. So naturally, how this it develops changes, and I can kind of explain to you the similarities and differences. So with a bacteria, what's happening is when you're when you are administered antibiotics, a lot of times if you don't take the whole course, there are some that may mutate and grow resistance to whatever antibiotic you're taking. And so penicillin, we see this often. There's actually an enzyme which is contained within the bacteria, penicillinase, which will actually cleave the penicillin compound. And so this is one mechanism of resistance. Now, let's think about viruses. What happened with the Delta virus and how did it develop? So in the spike protein that actually binds with the receptor within the human cell, that spike protein had a mutation. And so that develops because of the fact that this virus has the ability to it is still spreading. Vaccination is not at herd immunity levels. And so, it's still full vaccination levels are, in the 50s, still percentages. So, we're not at that level. So it's still spreading. And so as this spreads more and more, there's more and more opportunities for mutations, right? The more and more there is replication, the more and more DNA is being replicated and copied, the more mistakes that might happen. Mm-hmm. And the more mistakes, there's always that chance that one mistake will be the one that will make it a little bit more lethal or, more transmissible. And that's what happened with the Delta virus. And we're keeping an eye right now. None of the other viruses are actually, of major concern in terms of not the vaccine's not working, right? Mm-hmm. But we're all keeping, the scientific community is keeping a close eye on that.
Yeah. And Suri, I know that you are keeping a close eye on many things right now. So in closing, I wonder if you might share a little bit of that with our audience. And also I'm going to ask you, since we did not make it through all of our questions, if you might be willing to share some more afterwards so we can follow up with our audience and get more of their questions answered in some other format. We can work it out afterwards, but we've had a lot of questions from the audience and I wasn't able to get to them all. And I apologize to our audience members for that, but we're going to do our best to get those questions answered with our distinguished guests tonight. So maybe, Sri, you'd like to just close with, what are you keeping your eye on? What's out there for you? And then we'll say goodnight to our audience.
Sure. Yeah. I really thank the opportunity to be able to, share the experiences and just being able to be a part of this dialogue. And I want to, close with a sense of hope. We have been through difficult times in the past and many unknowns. In the 1980s, of course, with HIV. And so this is not the first time we've seen this. So in a way, I think it's comforting to know that this is kind of the era, the pandemic era is kind of a norm. So once you understand that, then you can prepare better. So what is in my radar as far as my research is concerned, I will be, of course, presenting with the American Academy of Family Physicians some information about vaccines and social factors that actually make a difference there. In general, I want each and every one of you to take precautions, continue to take precautions, monitor CDC guidelines closely, and always look to sources that are trustworthy and reliable. I hope you've enjoyed this. Thank you.
Oh, well, Sri, I have definitely enjoyed it. And as with all of our guests, I really just appreciate talking to super smart people to share their nuggets and insights and what a relevant topic this one is for all of us today. So thank you for that. And to our audience, thank you for joining us, and look for some of the responses to come in another format coming up soon. We'll do our best. Thanks again, Sri.
Thank you, Sue.
That brings us to the end of our event. We appreciate you taking the time out of your busy schedules to join us today, and thank you very much for submitting your questions for Dr. Banerjee. As a reminder, this webinar will be archived and can be viewed on demand. The link to access that is going to be sent in a follow-up email. You can also register for past episodes of Beacons of Light by visiting the links in the resource list on the toolbar at the bottom of the screen. In that box, you'll also find the ability to download a copy of the slides for tonight's presentation with links to some of Dr. Banerjee's research. Please feel free to share this content with a friend or a colleague. Thank you again to Dr. Banerjee and to Dr. Subocz, and to you, our audience, for joining us. Please have a safe and wonderful day.